Negotiations. How do I discuss the topic of negotiations briefly? This is a video. People tell me you can't take a long time on a video, so don't go on for 3 hours. So I can't. But I can discuss the topic because, well, I can just pick up one little one. Okay. So we've been around for 48 years in terms of negotiating with the Board of Education and the city and so forth. But we had an unusual negotiation outside of normal contract negotiations with the Health+Hospitals Corporation in 2019. In January of 2019, the MetroPlus nurses were managerial employees in the eyes of the MetroPlus. And as a result, they decided, management did, that they would have these nurses work an extra 1/2 of an hour every day for no extra pay. They'd go from a 35-hour week to a 37.5-hour week. This way, they figured they had to be more productive because they were there working for an extra 1/2 of an hour every day. I mean, that works out to an extra 130 hours and a half every year. I mean, isn't that got to be more productive? Well, in the summertime, the organization staff analysts came along and fought a war with DC 37, and we defeated them. And it turns out we won the election by a vote of 2-1, and we took over representation of the MetroPlus nurses. The very first thing we did was to go in and talk to management about why on earth had they done anything as dumb as adding that extra 1/2 of an hour. We told the story of how the individual managers quite often resisted by saying, okay, we'll say you're working halfway through your lunch hour until central office caught up with them. And others fudged it one way or another, but eventually central office caught up with each and every set of bosses, and they were all working the extra 1/2 an hour. And this caused morale on the part of the nurses to plummet. And productivity did not rise, quite the opposite. It seemed to go down. So here you had extra time and less productivity. And one more thing, you also had more MetroPlus nurses quitting, saying, if this is the way you're going to treat me, if this is how respect you're going to give me, I'm gone. Fortunately, a new boss had come in to be in charge of MetroPlus, that section where our nurses were working, and she thought we were making good sense. So she checked further and found out we were making good sense, and she said, look, I recommended to go the other way, but I'm not the final authority. So we reached out to Dr. Katz, the head of the Health+Hospitals Corporation, and gave him the argument, and also told him we had the support of the first-line top leadership down there in the MetroPlus itself. He thought we made really good sense. He gave the orders. All the nurses who had been hired to work for 37.5 hours a week were now allowed to work for 35 hours for no loss in pay. All those nurses who had been caught in January with being made to work the extra hours for no more money were now paid salary for that extra 1/2 hour for each day they had worked for all those very many months. Okay, that's not a very big negotiation. It only affected 60 people. But, if you have skilled negotiators, and if you really care to try to make sure justice is done, sometimes you can actually find that management isn't as unwilling as we think, and we get what we want. And we did in this case. And I was very pleased about it, and the nurses were very pleased about it. And you, too, will be very pleased if our negotiating team can do as well in the future for all of us as we were able to do in that one case.